It's a crippling disease that mostly impacts larger dogs. This morning we asked the vets about this hip condition.
Good morning. I'm Dr. Eric Anderson from the Ballston Spa Veterinary Clinic. Today we're going to talk about a nasty and devastating disease of dogs called hip dysplasia. And this is a disease of the hip joints, a developmental disease that leaves dogs crippled and lame without appropriate treatment. Hip dysplasia is an abnormal growth and development of the hip joints. And for the purpose of our discussion, I'm going to use my right arm as the femur or the thigh bone, and my left hand as the pelvis or the cup. This is a ball and socket joint, and it should be tight. It should be a deep fit, a tight fit. A hip dysplasia joint is very shallow, almost flat sometimes is the socket, so that the head of the femur is moving all around, very unstable. This first x-ray is of a normal dog. This shows the depth of the socket. There's a nice clean joint. It's very symmetrical, and everything about it is perfect. Now we're going to take a look at Zoe's x-rays. She's got her left hip, which is normal, but her right hip, as you can see, is very abnormal. It's very shallow and misshapen, and it just is not right. In terms of the diagnosis, again, the breed. Large breed dogs are much more susceptible. Familial history, if they know that. And then the symptoms: limping, bunny hopping, difficulty on stairs. But then the definitive diagnosis is made with x-rays. And the dog's got to be sedated to get good hip x-rays that are going to be diagnostic. So that's the what hip dysplasia is and how we diagnose it. Next time we're going to talk about what we can do about it, and there's a lot we can do. From Ballston Spa Veterinary Clinic, I'm Dr. Eric Anderson.
All right, if you have a question, ask the vets at cbs6albany.com.